Hello, my name is Jeff Scott, Associate State Director for AARP Illinois. I want to welcome you to this important discussion today concerning emerging healthcare and telehealth with our special guest, Dr. Clarence W. Brown, Jr. Dr. Brown is board certified in dermatology and founded the Advanced Skin and Mohs Surgery Center, where he serves as president and CEO while remaining on active clinical practice. Dr. Brown is the current president of the Illinois State Medical Society and has been a member of that organization for 25 years. He is also a member of the Chicago and Illinois Bar Associations. Dr. Brown earned his medical degree from the University of Pittsburgh School of Medicine in Pittsburgh, Pennsylvania. He completed his residency at Rush Presbyterian St. Luke's Medical Center in Chicago and a fellowship at Baptist Medical Center in Kansas City, Missouri. He also completed his Juris Doctor degree at John Marshall Law School, also in Chicago. Joining Dr. Brown to facilitate this discussion is AARP Illinois State President Philippe Largent. And finally, we are also honored to have AARP Illinois Executive Council member Toya Hemingway joining us today remotely. Welcome, Toya.
Hello, my name is Toya Hemingway, and I am proud to serve as an AARP Illinois Executive Council member. AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of older Americans for more than 60 years. AARP is proud to represent all those who are 50 plus in Illinois and our 1.7 million members. And we thank you for the opportunity to be your wise friend and fierce defender. AARP's mission is to enhance the quality of life for all as we age, leading positive social change and delivering value to members through advocacy, service, and information. AARP works tirelessly to fulfill the vision of a society in which everyone lives their best life with dignity and purpose, in which people can fulfill their goals and dreams. Critical conversations like the one today are the first step in finding real solutions to the concerns of those 50 plus and their families in Illinois. Thank you.
Thank you, Toya. I'm going to turn it over now to AARP Illinois State President Philippe Largent. Philippe?
Thank you, Toya. Thank you, Jeff. And thanks, Dr. Brown, for joining us today on AARP's Maximizing Your Money campaign. In the face of these continued trying times with the pandemic still coursing through our communities and inflationary costs driving up all sorts of things like food and medicine and energy costs, AARP is really committed to providing our members and non-members alike who are participating in today's video with information so that they can make confident decisions about how to spend their resources. And of course, for the most up-to-date information, I'd urge people to please visit our website at states.aarp.org/Illinois. That's states.aarp.org/Illinois. I want to welcome Dr. Brown to the discussion. Doctor, let's get into some of these great questions that we have. There's been so much information about COVID-19 vaccines and the need to get them, and certainly we've had the discussion about whether it's appropriate to get the vaccine or not, and who's eligible. And I think most people have made the decision to get the vaccine. Some people have made the decision not to. What is the latest that we're hearing now, or that you're hearing now about the vaccine? What's the latest information on either the standard vaccine or boosters against COVID-19 or the variants?
Certainly. Thank you, Philippe, and to AARP Illinois for this opportunity to discuss some of these important issues in healthcare that affect all of our members and the citizens of the state of Illinois. The question that you raised about where are we at with COVID-19 vaccinations is an important one. Just recently, the FDA has authorized new booster shots that are designed to provide stronger protection, stronger immunization against the latest Omicron subvariants, which are BA.4 and BA.5, that are still causing many infections and deaths, not only in Illinois, but around the country and the world. These two new boosters are available. One is made by Pfizer for use in people as young as 12 years of age, and the other is made by Moderna for those that are 18 and older. The doses can be given to those who have had their initial shots, whether or not they've had any other boosters, but you should not have these new boosters within a 2-month window of having had another. It can be confusing sometimes for the public to understand where we're at with these vaccinations and these boosters. And so we encourage, the Illinois State Medical Society encourages all state residents to reach out to their physicians and engage in an open dialogue so that they receive accurate information that's in their best interest.
Thank you very much, Dr. Brown. Speaking of the pandemic, certainly one of the issues that we saw during the pandemic was people not utilizing the healthcare system because they were simply afraid to leave their homes and venture out into the community or take public transportation or be in areas where they would encounter other people for fear that they might catch COVID-19 during the pandemic. And one of the ways that we tried to solve for that was encouraging the use of telehealth. Can you talk a little bit about what telehealth is today and what it means to patients, and what's the future of telehealth moving forward in Illinois?
Certainly, Philippe, that's another great question. If there's any silver lining in the context of this tragic pandemic that we've all been living through for nearly 3 years now, it's most likely telemedicine. Telemedicine is the ability to engage with your healthcare provider, especially doctors, and have basically a virtual visit. It can be done utilizing cell phones, small video cameras that can plug into computers, and it allows you to stream directly into the doctor's office and have not only voice but visual image interaction so that continuity of care can be maintained, and individuals who are reluctant to venture out can still receive necessary care so that care is not delayed and put off.
Excellent. And telehealth is available now system-wide, and our programs like Medicare and Medicaid and private insurance reimbursing for that kind of service?
Yes, actually, not only are the conventional commercial payers such as the Blue Cross, United Healthcare, Cigna, Aetna, Humana reimbursing for telehealth visits, but as well, Medicare and Medicaid are also reimbursing for telehealth visits. And recent legislation was passed in the state of Illinois requiring parity by these payers, of course, not the federal programs, but the commercial programs actually have to provide compensation similar to what would be provided if the patient ventured into the office in person. So this has helped a great deal to engage physicians' offices to provide this service and to allow patients to embrace it. So all of the payers are required to cover that service as a result of the recent legislation.
Outstanding. Thank you, Dr. Brown. Switching gears just a little bit, I know that AARP and the Illinois State Medical Society work together on ensuring that patients had adequate information when going out to their insurance companies' websites, for example, to find their physicians who are in network. And I don't want to get too much into the weeds on the healthcare terminology, but prior authorization I know is a topic that we've worked on together. What does that term, for our viewers, what does that term refer to, and what changes relative to prior authorizations have been made in Illinois?
The term prior authorization, Philippe, actually is used in healthcare to describe what happens when one visits a doctor and the patient is prescribed a medication or requires a laboratory test such as an MRI. The insurance company will then sort of intervene or step in between the patient and the physician to authorize that prescription or that laboratory service. And they require a prior authorization before the patient can either receive the script or get the test. Previously, this was very burdensome. It could take not only days, but not only weeks, but sometimes even as long as a month. And you would have cancer patients waiting to receive chemotherapy and waiting to receive a prior authorization from their insurance company that they were allowed to actually get that care. The Illinois State Medical Society advocated on behalf of the citizens of the state of Illinois with the help of AARP. We were effective in getting a bill passed in 2021 that restructured how prior authorizations are performed in the state of Illinois, shortening the window of authorization for urgent prior authorizations to 48 hours and non-urgent to 5 business days. Furthermore, it requires that in issues of acceptability in the treatment plan are questioned, that review must be conducted by a peer-to-peer review where a physician is engaging with a physician to discuss that appropriateness. And it has a very defined appeals process. This legislation was passed in both chambers of the Illinois government unanimously. I know that sounds almost like I've made a mistake there, but no, every member that was elected to state government in Illinois voted in favor of this bill, because we are all aware that prior to this legislation passing, this was extremely burdensome and harmful for the citizens of the state of Illinois.
And on that, and on a related note, Doctor, and that's really helpful, and I'm delighted to know that those changes were made. On a related note, the issue of network adequacy, the ability for patients to know that their doctor is in the network of their insurance company, and can avoid seeing a physician who is what's called out of network and tends to be more costly. I know network adequacy is a major concern, and really one in which the health plans have a certain level of responsibility to make sure that their networks are not only adequate in terms of the number of providers, but that the list of providers is up to date so patients have the most current information. What has changed relative to network adequacy, and what are the rules or laws that impact that have changed that are beneficial to consumers?
Certainly. As far back as 2017, the Illinois State Medical Society was effective at getting the Network Adequacy and Transparency Act passed in the state of Illinois, which required health insurers to keep their network information up to date and to create networks that actually provided adequate care, meaning physician participation, to the members that they were selling insurance policies to. Since the time that act was passed, however, the Illinois Insurance Agency has not empowered the act with rules and regulations for which it would be governed. Most recently, many of your listeners may be aware that the agency actually enacted a fine against Blue Cross Blue Shield of Illinois for failing to maintain an adequate network, particularly for Illinois residents that live in less populated, more rural areas. They were publishing lists of providers that were extremely out of date, providers that were no longer engaged in those networks, and patients were having a great deal of difficulty to find find the care that they needed. So the Illinois Insurance Bureau actually placed a fine of over $330,000 on Blue Cross Blue Shield and set in motion a system of developing rules and regulations that would actually govern that act. We expect that moving forward, the state will play a much more active role in ensuring that patients have access to the care that they're actually paying for.
Fantastic, great news, and I look forward to continuing in that work with the State Medical Society. We're towards the end of our discussion. I do have one more question. Certainly, recently in the news, the issue of prescription drug costs has been discussed, and I feel like we've been discussing it for years and years. And certainly AARP is delighted by some of the actions that are happening at the federal level relative to lowering prescription drug costs. But relative to our work in the state, what are some proposals or ideas for Illinois state government to help lower prescription drug costs for Illinois residents?
Well, that's a great question. Currently, as you mentioned, there has been some recent federal legislation that's been passed, the details of which have not been fully, let's say, made aware to us or fully figured out. That'll certainly impact what the state is able to do with respect to some of the federal sponsored or federal supplemented state programs. Currently, we're all very well aware that many citizens actually really feel burdened by the cost of prescription medications, particularly some of our older patients who require these medications to maintain life and livelihood. One thing that we have found that can be very effective in addition to prescribing generic medications is there are some third parties out there that actually offer prescription drug benefits or cards that give discounts on prescription drugs that you may actually see advertised on the TV. One that jumps to my own mind, only because I've used it myself, is one that I'm not endorsing, but it's called GoodRx. And this card, this program, there are several, but that one jumps to my mind. If you mention that to the pharmacist when you're checking out prescriptions, they can run the prescription through the GoodRx system to see if it comes up at a significantly lower cost. So I encourage all listeners, all of your listeners, and all members of AARP to explore if these prescription discount programs can apply to them.
Dr. Brown, this has really been informative and helpful today. I really do appreciate your time. Do you have any final comments before we close out?
Thank you, Philippe. It's been a pleasure to be here with you and your listeners, and not only a big supporter of AARP, but I'm a member myself. I just want to encourage all of the listeners to think about no longer